Welcome to our addiction series with Dr. Ashok Rao. He looks like Nasiruddin Shah. He's got as good a voice, but actually he's from Freedom Foundation, and he's here to discuss with us what we mean when we say addiction. How do we deal with it? What are the dangers of addiction? And if you are an addict or you know someone who is, how do you deal with that situation? So let's start with the first point, of course, is addiction. Now, we always say, I'm addicted to movies or music or my girlfriend or my wife or both of them sometimes. How do you define an addict, or how do you define addiction?
When we talk about addiction, we normally associate it with something like drug addiction or
Yeah.
addiction to alcoholism. Now, when we try to define that, what we're really looking at a sense of dependency on an inherent substance that causes profound and chronic psychological, social, spiritual, and mental harm. Where the
Oh, you're going to have to repeat that for us again. So
okay.
we're saying that, let's take one of them, alcohol addiction. You're saying it is a substance that causes?
That a dependency on a substance that can lead to chronic psychological, social, behavioral, and spiritual consequences where the individual starts harming themselves.
This sounds really scary, is it?
Yes, it is.
How do you identify an addict?
Well, basically, it depends on what we are looking at. The first problem here is really that most people do not consider by themselves that they have a problem.
They're in denial.
They are in absolute denial because that's the biggest challenge when we are talking about addiction. So, most of the time, it is the people who are around the individual who start recognizing that maybe there is a problem.
What are those signs that you need to look for?
Yes. So usually it is based on, to a larger extent, on behavior of the individual. It is also in terms of his appearance, the way he or she goes around doing things, which sometimes define what we consider as normal or rational. And this usually leads to a whole lot of inappropriate actions and behaviors. For example, you'll find the person not willing to take care of themselves. For example, there is no sense of routine or structure in the individual's life. The person might be sleeping excessively, might be, going to bed at very odd hours, so on and so forth.
Let's look at one particular point, alcoholism. When do you classify it as an addiction?
There are days, maybe, since consuming alcohol seems to be a legitimate thing. Many people have a drink or two, then they don't really have a problem. But for some people, and this is important to understand, when we look at the causative factors of addiction, then we are also looking at that there is a certain sense of genetic predisposition. We know for a fact with research that's done, especially in the West, that certain people have a definite, strong possibility of becoming addicts to whatever substances that they get hooked onto. And this is because there'll be somebody in the family structure in the past, somewhere down the line, who might have had a similar problem. They are born with this susceptibility. So, over a period of time, on the introduction of any such chemicals, in this case alcohol, that is because what is alcohol? And this is again a bit of a misnomer. Many people think alcohol is different from drugs. Alcohol is as much a drug as any other drug. There is a chemical composition and organic compositions in the alcohol that you consume, and they act like any other drug.
Even though Dr. Rao keeps saying you, he's not talking to me, he's talking to you. In fact, please continue watching mDhil and subscribe to our channel.